Well, good afternoon, everyone. My name is Rita, and I am a program specialist here for the Wood County Committee on Aging. I am very excited to offer this special program today, provided by our very own Social Services Department. So I'm going to turn it over to Lisa, who is the Director of Social Services, and she will get us started here.
All right. Hi, everybody. Thanks for joining us today. Today, what we're going to talk about is we're going to do an overview about Medicare. So just briefly touch on some of the parts and pieces of Medicare, as well as the options you might have under Medicare. And then we also are going to talk about what you can do during the open enrollment period, which is October 15th through December 7th. So myself and I'd like to introduce my other staff. Denise Kaminsky is our nurse. So Denise, do you want to say hello?
Hi.
And then also we have Jessica Ricker, who is one of the social workers. Jessica, can you say hello?
Hi.
Okay, and they will be talking, we're kind of splitting up this webinar. So I'm going to be covering some slides, and then each of them will be covering some slides. But we were all trained under a program called OSHIP, which is the Ohio Senior Health Insurance Information Program. And it is a federally funded program, basically to provide Medicare education. We offer, it's free, it's unbiased, it's objective. It's basically, we're not trying to sell anything. We don't make a profit off of this. This is really just to help educate Medicare beneficiaries. But with that also, we also can't make the decision for you as far as what choice you decide for your own coverage. We can give you all the information and then you can make an informed decision. The three of us here, do the counseling, but you can also reach counselors via calling the hotline in Columbus, which the number is listed there. There are counselors available at OSHIP in Columbus. And also OSHIP is offering virtual counseling sessions this year. And I added the link there. You can actually go on and schedule your own virtual counseling session with an OSHIP representative from the Columbus office. We hope to hopefully at some point in the near future offer face-to-face visits with us here in Wood County. That has yet to be determined. So, if you are uncomfortable with the virtual counseling, please check back with us as time goes on. And, hopefully once we are able to sit down with each of you, if that's what you need, we can do a face-to-face within the, hopefully within the next month is my guess, but don't hold me to it. All right, so with that being said, I'm going to turn it over now to Jessica Ricker, and she is going to discuss what Medicare is and particularly the parts of original Medicare. So Jessica, I will turn it over to you.
Okay, perfect. So we'll start by what is Medicare. I'm sure you're familiar that it's for individuals that are 65 and older, people of any age and disabled, and then individuals that are diagnosed with end-stage renal disease. So I'm going to focus on option 1, which is original Medicare, and then later on in the webinar, we will get to option 2 and teach you about that and give you a little refresher. But option 1, it's kind of 3 split parts. Everything is kind of separate, as you can see in the picture. So it's parts A and B, and then it's the secondary insurance. So we're often referred to as a med supplement as well. And that's something that you can purchase in addition to having parts A and B and your prescription drug coverage. Again, we'll go into a little bit more detail later on. And then your prescription plan. So A and B, prescription plan, and then your supplemental as well if you're interested in purchasing that. So the way that kind of works is original Medicare is accepted anywhere that Medicare is accepted. So you don't have to look around for specific doctors and hospitals like you'd have to do with the Advantage plan. So that's kind of a nice portion to original Medicare. And then also it's 80% of that is covered by Medicare, and then you are left with the 20% of whatever the cost is. And that's where individuals kind of like to purchase that secondary insurance to have that kind of backfall or that little bit of a safety net for what that 20% might look like.
Okay, Jessica, or you want me to go to the next slide?
Yeah, sure. Sorry.
Okay. Oh, hold on. What? Okay. There we go.
Okay. So diving a little bit deeper as to what parts A and B are. So you can see that those are the parts that are listed on your Medicare card. But parts A, that's what you have worked your 40 quarters for, and you've earned your part A if you've put your time in. So that portion to you is free of cost, and it covers the hospitalizations, so inpatient hospitalizations, your skilled nursing facility stays, home health, and hospice. So when they say inpatient, what does that mean? So that's your semi-private rooms, your meals, and that type of thing, and the drugs that you might need for that treatment at that time. And then it generally covers 80%, like I had mentioned. And then if you are in the hospital, you do have to remember to get the skilled nursing facility to get that covered. You have to be in the hospital for 3 midnight. So that's something really, really important. If you're having a hospitalization and you're kind of expecting to need that skilled nursing stay, you do have to remember that you must be there for 3 overnights in order to qualify for your skilled nursing stay. So Medicare covers up to 100 days of the semi-private rooms in the skilled nursing stay. So that's your rehab services, with your physical therapy, they offer those types of things throughout that time, and that would be covered. And then after on, then it would be up to you. And again, that's where individuals would purchase that secondary insurance to maybe kind of help out with those types of stays and that type of cost that they might be getting if they have to go over the amount that Medicare would cover. But just the thing to remember is those 3 midnights. And then the home health care. So after that skilled nursing stay, you know, you would have to, you'd qualify for that, the home health, and then the hospice as well. And then when you're looking at Part B, the outpatient services, your doctors and providers, your preventative benefits, and then your DME equipment. So that is where there's a bit of cost that you would pay monthly for your Part B premium. And you're probably paying that. That's a monthly thing that you'd pay. And then that cost, we don't know what it's going to cost in 2021, but on the next slide, it will tell you a little bit more in depth about those costs. So as you can see, the 2020 Medicare amounts, we don't quite have the 2021 Medicare amounts. Those will eventually be coming out in the near future. But the monthly premium for Part A for most individuals is free. And then it tells you the hospital deductible on the screen there. And you can see the copays as well. And then what that skilled nursing copay looks like after days 21 through 100 or through that period. And then Part B, there you can see how much that is costing you at this time. Again, that may rise in 2021, and that premium is maybe based on income, but those are the costs that you're looking at.
And I'm just going to chime in real quick and just touch briefly on the hospital deductible. So again, this is original Medicare. If you go inpatient into a hospital and you only have red, white, and blue, that red, white, and blue card, your original Medicare card, that hospital deductible is not an annual benefit period. That is a 60-day benefit period. So that's important to take into note that, you know, depending on how frequently someone would be admitted to a hospital on a calendar year, you may have to pay that $1,408 out of pocket multiple times throughout the year if you only have original Medicare and you don't have a supplement or you don't have a Medicare Advantage. All right, so I will talk a little bit about the Medicare Savings Program. So as we mentioned on the previous slide, currently the Part B premium for most individuals is $144.60. So we don't know if that will go up or not. Like Jessica mentioned, we'll find out probably more like November or December. But for most individuals, the Part B premium is $144.60 currently. Some people with limited incomes can qualify to get that premium paid for them through essentially Medicaid, but it's called a Medicare Savings Program. So if someone is has an income of less than $1,456 for a single person, they could get that Part B premium paid for them. And also they have to have resources less than $7,860. So if you think you might be eligible for a Medicare savings program, you would want to contact the Wood County Department of Jobs and Family Services. They would be the entity where you would apply for these MSPs. I know there is also a program under the MSPs that if you're a much lower income, for example, if you make less than $1,084 a month as a single person, it will not only pay for your Part B premium, but it also can provide you some other basically supplemental insurance to you at no cost, again, based on your income. So those are some programs you might want to look into if you feel you might qualify and apply with Jobs and Family Services. Okay, now Denise Kaminsky is going to discuss, so we talked a little bit, Jessica talked a little bit about original Medicare, Part A and B, your red, white, and blue card. And now Denise is going to talk about that supplemental insurance under option 1. So I'll take it away, Denise.
So if you remember back to this, the third slide where they showed original Medicare option 1 and then Medicare option 2, we're going to talk right now about the section on the left-hand side there. So secondary insurance can be any group health insurance plan. So if you or your spouse are still working, but you're over 65, so you qualify to carry Part A and B, and you want that extra supplemental insurance, as long as you have a credible insurance plan through your employer or your spouse's employer, you can keep that plan. You don't have to necessarily sign up for a Part C. That would become your secondary. Or if you're on Medicaid, or if you you can go into the private insurance for the Medicare supplemental insurance. If you go to the next slide. And these are just, the secondary it covers, again, and I think this has been said a couple of times, it covers what Medicare A and B doesn't. So you're not left with that 20% out of pocket. On the Medicare supplementals, also called the Medigap or the MedSup or Plan C, Part C, they're all the same. But a Medicare supplemental insurance plan, there's a lot to choose from, and there's a lot of different companies that sell them. And if they sell a Plan A, every company that sells a Plan A has to be exactly the same. So the only thing that varies from plan to plan are the premiums, or from company to company, I should say, are the premiums. Generally with these insurances, you have no network, so you can go anywhere you want. You can see any doctor you want. If your doctor says you need to go to U of M, you go to U of M. If your doctor says you need to go to Cleveland Clinic, you go there. So that's one thing to consider when choosing whether you're going to go with option 1 or option 2. You also tend to pay a little less out of pocket. Your monthly premium might be a little higher than option 2's Med Advantage plans, but you don't pay a lot once you use these services. So this one is kind of like you're prepaying. The other option, which we'll talk about in a little bit, is like you pay as you go. The guaranteed issue just talks about underwriting, medical underwriting. So if you do go into a medical supplement Medicare supplement insurance plan, you are during the open enrollment period, which is either around your birthday or during this open enrollment, October through December, then you won't have medical underwriting. You're guaranteed issue of a policy. The next one. Oh, that one's you. Oh, I can't hear her. I can't hear you, Lisa.
That's probably because I should take myself off of mute. Thank you. So as I'm going to be talking about the prescription drug coverage now, which as if you look at this slide, so Jessica covered original Medicare, Denise covered the supplemental, and now I'm going to talk about standalone drug plans. So if you go with option 1, you do need to purchase a standalone drug plan if you don't already have credible coverage. So that would be considered a Medicare Part D prescription drug plan. And these are plans that you purchase from private companies, and you would need that coverage to be able to cover your prescriptions at the pharmacy. So some people with Med Advantages do that, and does include their drug coverage, and we'll talk about that here in a minute. So, but with the standalone drug plans, you pay a premium every month for these plans. And what you can do during open enrollment is you can put all your medications essentially into Medicare.gov, or OSHIP representatives can do that for you. And it will bring up the 2021 plans, and it will show you what the cheapest plan is going to be for you in 2021. So that might not necessarily be the plan that you're in right now. That's why every year they really do recommend you look at your standalone drug plans to see that, you know, first of all, is your current plan going to be covering all your medications next year? Are all your drugs on that company's formulary? And also, is the cost affordable? All of you that have prescription drug coverage should be receiving what's called an annual notice of change from your drug companies. And it should tell you if you're up next year under your plan, if a drug that you're on is no longer going to be covered under their formulary, they must notify you of those changes for 2021. So then at that point you can say, oh wait, you know, my premium is going to go up, you know, $50 a month. I don't want that, you know. So then you can go on and either meet with one of us or go meet with something called OSHIP, and we can go on, help you go on Medicare.gov and enter in your medication so you can see, you know, if there is a cheaper, better plan out there for you. So that's something to, and again, it has to be October 15th through December 7th. Now, any changes you make during that open enrollment period are not going to take effect right away. The coverage does not start until January 1st. So even though you're making the changes now, it's not going to start until 2021, which is January 1st of 2021. So for Part D costs in 2021, what we do know is the monthly premiums range anywhere from as low as $7 a month for a plan all the way up to $88 a month is the highest premium plan in 2021. It really depends on the type of medication you take, the cost of the medication you take, but there are lots of options out there to choose from. The annual deductibles, they are going to range anywhere from $0 annual deductible all the way up to $445 deductible. So typically what we see is the lower the monthly premium, the higher the drug deductible, and vice versa. The higher the premium, the lower the deductible. It really just depends on the type of medication you're on. If you're on a very expensive, high dollar brand name drugs, you're gonna probably gonna need a different plan than someone who's on, let's say, maybe one or two or all generic medications. So again, that's why it's very individualized to you. The cost is based on, you know, what medications you're on, and you wanna make sure that that drug company has all of your drugs on their formulary list as well. You do need drug coverage. If you don't have credible coverage, and you just don't pick up Part D because you just don't feel like you need it, because maybe you don't take any medicine, you can be penalized 1 month for every month you were eligible for Part D and did not take it. So that is something to know. There is a penalty for that. As far as the co-pays under these Part D plans, Typically it's 25%, or some of them will have a flat rate. So depending on like if you're on a tier 1 or tier 2, which typically are generics, you know, they might have a flat rate that you would pay for that drug. Again, it depends on the company. But you would basically pay your co-pays and co-insurances up until you reach a maximum, your total drug costs reach a maximum of $10,680. So some people's drugs are never going to reach that in a calendar year. Most people's drugs aren't, but some people's will. Once you meet that threshold of the $10,680 in total drug costs for the year, you fall into what's called catastrophic coverage. So after you fall into catastrophic coverage, you would only pay 5% of your medications copays for the remainder of the year. And that kind of leads me into the coverage gap, which I'm not going to get too deep in the weeds with that, but it was otherwise known as the donut hole, the coverage gap. So the coverage gap basically under Part D begins after you and your drug plan have spent a certain amount of money on your covered drugs. So for 2021, that amount is going to be $4,130. So again, that's you and your drug plan. That doesn't include the premiums you're paying for the plan, but that does include all of the cost, the full cost of the drug, you know, what co-pays that you're paying, et cetera. So once you make that $4,130, and again, not everyone's even going to make it out of that initial gap, coverage gap. But if you do, then you fall into the coverage gap, and then you pay basically 25% of the cost of your drugs. So for brand name and prescription, or excuse me, generic drugs, you would pay 25%. So you would continue to pay 25% until your total out-of-pocket costs reach $6,550. So once you reach that $6,550, that's when you would fall into catastrophic coverage. And you would only pay 5% of the drug costs after that. So some people will never fall into the coverage gap. Some people will fall into it and never fall out of it at the end of the year. And some people might go into it, come out of it, and fall into catastrophic all within the same calendar year. And again, it just has to do with the price of your drugs and how expensive they might be. So when you're in that coverage gap, maybe a question would be like, what counts towards to fill that gap and get out of it? So they count for brand names, they count, you know, not only the 25% that you're paying, but they also count the full drug cost. So that will help cover or close that gap. But for generic drugs, they only count what you're paying. They only count that 25%. They don't count what the drug company's paying. They only count your 25% copay towards the coverage gap. So again, some people will come in, some people will come out, some people will never enter the gap. It really just depends on the medications that you're on. So something to keep in mind when you're looking at drug plans is really just what's the convenience, you know, do they cover your pharmacies that you go to? Do they cover all your drugs on their formulary list, or all your drugs covered? And is it an affordable cost? So we always recommend people go with cost, convenience, and coverage. And we can assist, or OSHIP can assist with these drug plan comparisons, or you, if you're comfortable, can also go on Medicare.gov. That is the platform that we use to do these drug comparisons every year during open enrollment. Okay. There also are, just as there was Medicare savings programs for people that might not be able to afford that premium for Part B, there also is some extra help, or called low income subsidy, for people who might not be able to afford their prescription coverage. So if for 2020, for example, if you were a single person with your income of less than $1,615 and resources less than $14,610, you would qualify for a low income subsidy, which then that means that you can fall into some of the drug plans that have zero premium, and you would also pay less for your prescriptions. I want to say it's like no more than maybe $9 for brand names and like $3 or $4 for generics. So again, that's called low income subsidy, and you would actually apply for this program. It's also known as extra help with prescription drug coverage through the Social Security office, or on their website. You would fill out an application on ssa.gov to see if you're eligible for extra help with your drug and prescription costs. Okay, and now I believe Denise is going to cover, so we've covered option one, original Medicare, a supplement if people decide to pick that up, and prescription drug coverage. And now Denise is going to discuss the option two. And you're on mute. Yeah.
Yeah, mute. Yeah, thanks. Option two is what you see on the right side of the screen here, the Medicare Advantage plans. Now, you're going to get a ton of mail and phone calls, and you'll see, well, I don't know about phone calls, but a ton of mail, and you'll see a lot of commercials on TV for all these different programs that are out there. Medicare Advantage plans, zero premiums, home delivered meals, home care, transportation, all this stuff. Those are the Medicare Advantage plans. Those are available for anybody that's on Medicare A and B. So you choose between the option one and the option two. They're an alternative to the option one. And they're usually a HMO or a PPO. An HMO is a health management organization, and it's a pretty tight network. So if you go into one of those, you have to use their doctors, their labs, their hospitals, their group. You have to stay within that group. The PPOs is a preferred provider organization, and that has a little bit more leeway. They want you to go to their providers. They'll give you a better deal if you go to their providers, but they will still help pay if you go outside the network, but generally it's going to be at a higher cost to you. Most of these plans, but not all, do include a Part D, which is your drug plan. So, a lot of people see these as very convenient and low cost, because they will include drug plans. And like I said, a lot of them are at zero monthly premiums. Excuse me, I'm getting a frog. You're still responsible for your Part B premium. So your A is free, you pay for your B, and then any other costs, you still have your co-pays each year that you have to meet for those. And then if there is a premium for the Med Advantage. Generally, you carry the one card. You don't have to carry your Medicare card around with you. You just carry the card from the Medicare Advantage plan, and they kind of manage your Medicare as well. It's the Part A and Part B. Next slide. And then I think we're going to the next slide. Thank you. The initial enrollment period is the same as regular Medicare and option one. It's during that 7 months around your birthday, the 3 months before, the month of your birthday when you turn 65, and the 3 months after, or during this time that's coming up of open enrollment from October 15th to December 7th. Again, if you sign up for a Medicare Advantage plan or you change from a plan that you're in right now and go to a new one, it doesn't start till January 1 of 2021. You can, if you're switching between Medicare Advantage plans, you can also switch. Like if you switched in this October for a Medicare Advantage plan, and then you were enrolled January 1st, you kind of can try it out from January 1st to the end of March. During that time, you can switch. So you can switch back if you decide you don't like it, or you can switch back to the original Medicare. But you got to remember that if you switch to a Medicare option one supplemental policy, you may be subject to medical underwriting, and that would affect your premiums. I believe that's it. Jessica? No?
So Denise kind of just touched on this, but moving between the options and when can you do that? Well, right now during open enrollment coming up here is kind of the prime time to be doing this. So you can move, if you're original Medicare and you're not happy with that, this is the time where you can move from that and investigate the Advantage plans. And if you want to change, you can go forth and change to the Advantage plan. Then she had mentioned if you're an Advantage plan and you kind of want to switch during open enrollment, great. And then look at that other enrollment period too. There's that special time you can continue switching if you needed to. And as far as supplementals, you can switch your supplemental at any point. You can switch those at any point. There's no specific enrollment period for those, but just be mindful of the medical questions that they may ask you throughout that time. But open enrollment from October till December is kind of your prime time to do the switching around if you'd like to.
And I will add, the only time that you can get into a Medicare supplemental plan is without being medically underwritten is when you're 65 and you're brand new to Medicare, or let's say you delayed your Medicare Part B. Let's say you turned 65, but you didn't take your Part B right away because you were still working. And so you didn't, you delayed your Part B without penalty. And then you decided to accept your Part B. So 65 or new to Part B, you have, and correct me if I'm wrong, ladies, 6-month window. Is that correct? Yeah, you have a 6-month window to get into a supplement if you so choose, and they cannot ask you medical questions. Now, outside of that, what they call the initial enrollment period, when you're first 65, first new to Medicare, or first new to Part B, the only other time you really can get into a supplement without being medically underwritten is, let's say you had a supplement and they like went out of business, or you know, they just stopped offering your plan or something like that. That would be a special election period where you could then get into another plan and not be medically underwritten. But if you're just going from one to the other to save money, or because you don't like the company or whatnot, then you could be subject to some medical questions. Again, these companies are in the business of selling insurance to people over the age of 65. So it's not that you won't find coverage. It's just that you might pay a little bit more for it, depending on your health. Okay, so in summary, the differences then between Medicare supplements and Med Advantages. Everyone pays their Part B premium. So, you know, unless you're on one of those assistance programs, everyone is required to pay the Part B premium. Under supplements, they are a higher premium. So they could be $150 to $200 a month in addition to that Part B premium. So it is a higher premium, but you might have little to no out-of-pocket costs. So you're not going to get a lot of bills in the mail. As long as your services are covered under Medicare, your plan's pretty much going to pick up the difference. With Med Advantages, you still pay that Part B premium. You might have much lower premium costs under Advantages, maybe $0 to $100 a month, but you are going to be charged out of pocket as you use the plan. So you're going to have copays when you go to the doctor, you know, primary care copays, specialist copays, copays maybe for labs, outpatient surgeries, things like that. Providers, so with supplements, you can go anywhere Medicare is accepted. So if you are snowbirds and you go to Florida for the winter, you travel a lot, you know, these do not have networks. They're accepted anywhere Medicare is accepted. Med Advantages, like Denise said, you do have to stay within their networks and go see the providers that they ask you to see. Or with HMOs, you will, if you don't, you'll pay 100% of that service. With PPOs, it's usually, they'll allow you to go out of the network, but you pay about 50% still of that cost. Considerations, so let's see. So again, I mentioned that it's important to use any provider without network restrictions for the supplements. If you can afford a higher monthly premium, you know, that's a consideration under the supplement. Medicare Advantage, if you're willing to use networks, then that's great. Some Med Advantages also do have some added coverage. So maybe they'll offer some dental or some vision coverage, maybe like a couple screenings a year or a couple preventative dental cleanings a year. So it just depends on the plan. With supplements, they do not offer any vision or dental. So that would be something you'd have to purchase separately if you wanted that kind of coverage. And then with supplemental, you do have to purchase your own standalone drug plan. unless you have credible coverage through another source. With Advantage plans, the drug coverage is often included in the plan. So again, that's kind of just an at a glance difference between the two. All right, Jessica, you want to talk about unscrupulous sales practices?
So this is a high pressure time where they are going to try to persuade you to join their plans and get in this and that, and they make it sound really great. But watch out for these different things that individuals may try to do. They try to go door to door. So if you're living in an apartment complex or something like that, just know that they are not allowed, companies are not allowed to go door to door and do that type of thing. They may try to phone call you and make an appointment to show up to your place. So watch that. They can make appointments to do that, but just be aware. They can't give out cash for gifts items that are exceeding $15. Again, it's a high pressure time. They're going to try to wind their way around to get to you. And just watch out for the misrepresenting a plan or giving incomplete information. Just be aware of what you're getting yourself into. And if you have any questions or you think something's sketchy and you want to run it by us, feel free to call and we'll try to help you out with that. And people will try to represent themselves as Medicare, and that's not something that's typical. So just be aware of who's trying to contact you and call you, and watch the different mail and things that you get.
Okay. Yes. Yeah. Social Security and Medicare are very rarely ever going to call. So if they do call, they're not going to ask you for your Medicare number. They're not going to ask you for your Social Security number because they already have that on file. So that should be a red flag right there. So just don't give out any of your personal information over the phone, even if someone's saying that they're calling, even if it looks like on the caller ID, if you have a caller ID and it's showing Social Security, say, no, I'll call, I'm going to hang up and I'll call the number I have for Social Security and then go that way. Just to be, you can never be too safe. So in conclusion, just thank you for your attention. And if you have questions, again, there is the OSHIP hotline down there in Columbus so that you can contact them. You can do the virtual counseling as well. And, or you can also give one of us a call here in social services. We can try to do as much as we can over the phone right now. So we can send you a paper, like for example, if you're wanting to compare a drug plan, we can send you a paper where you would basically write down a list of all your medications, send it back to us. We can go on Medicare.gov, do the comparison, and then call you with the results or send you the results in the mail. That's something we can do up until we know when we can schedule face-to-face visits. But if you're pretty savvy on the computer, you might be able to do Medicare.gov yourself or the virtual counseling, or just give us a call. I also wanted to just mention one thing as well, is if you have insurance through another entity. So everything we talked about today is mainly geared towards people who just are in the open market under Medicare. So if you have a plan through like your old employer or retiree plan, or you're with STRS or OPERS or something like that, you really should contact the benefit person at that entity. Just, it's important to check with them to see, I don't want you to make any changes and then have anything be disrupted with your, with your old employer plan or your STRS or OPERS. So again, if you have another entity like that involved, it's best to contact that benefit coordinator person first, and then give us a call. So again, just in review, knowing your options, option 1, option 2. So I guess at this time, we will open it up for questions. So if anybody has any questions, Rita, I will turn it over to you.
Yes, so I just want to thank you, Lisa and Denise and Jessica. We have an incredible social services department here at the Wood County Committee on Aging. I am going to stop the recording at this time just so we can leave our questions for this group here. So again, thank you to our social services department for doing all this.